And now, please rise as we introduce the Upstate graduates of the year 2012. The student marshals are Samuel Schuler and Michael Doherty. The College of Medicine flag bearer is Chirag Patel. Faculty marshals include Dr. Susan Stearns, Dr. Leslie Major, Dr. Donna Bakke, and Dr. Thomas Dennison. academic officers, and honored guests include Dr. David Duggan, Interim Dean, College of Medicine, Dr. Rajesh Dave, Dean of the Binghamton campus, Dr. Kwame Amankwa, Associate Professor of Surgery and Cell and Developmental Biology, who is giving the Hippocratic Oath today, Dr. Lynn Cleary, Vice President for Academic Affairs and College of Medicine Senior Associate Dean for Education, Mr. Ryan LaFollette, representing the class of 2012, Dr. Julie R. White, Dean, Student Affairs, Dr. Wanda Thompson, Associate Senior Vice President for Operations, Mr. Thomas Taylor, a member of the Upstate Council, Mr. David Northrup Jr., Chair of the Upstate Council, Dr. Patricia Joy Newman, Honorary Degree Recipient, Dr. Abraham C. Verghese, Honorary Degree Recipient, Dr. Deborah Buchan, President of the Syracuse Medical Alumni Association, and Dr. David Smith, President of Upstate Medical University. And now, Ms. Monica Moranti will sing the national anthem.
It is my pleasure to introduce Dr. David Duggan, Interim Dean of the College of Medicine.
Good morning and welcome, everybody. Please sit down, relax, get comfortable. Okay. It's my great pleasure and indeed an honor to welcome you all today to the commencement exercises at the College of Medicine at Upstate Medical University. I'm the interim dean, and this is truly a special day for all of us. We've arranged for the weather for you. That was part of your tuition payment. We appreciate that many of you have traveled far and wide to come here, and we really look forward to spending a wonderful day with you. My job is really to kind of set the agenda and then get out of the way, because the things we want to focus on are the people up here on stage, our graduates, our honorary degree recipients, and their accomplishments. But I do want to just mention a couple things about what I hope we can accomplish with today's exercises. First of all, today is a day to celebrate. It's a day to celebrate the accomplishments of our graduates, their long years of study throughout high school and college, and now throughout medical school. They really deserve a great deal of credit. And we're also here to celebrate the lives and the examples that have been set by our distinguished honorary degree recipients. They, as physicians, have set the standard that we all should aspire to, and they truly are inspirational. So we appreciate and celebrate them. Today is also a day to appreciate, and to appreciate specifically the support that the families and friends have given to their children and friends to help them through medical school, their long days of study. I know that they appreciate that, and I want you to know that as well. So appreciation for you. And also to appreciate that today is the beginning of a fantastic opportunity for our students. Today they earn their degrees, tomorrow they begin their professional lives. And the impact that this 160 people can have on the lives of tens of thousands of people is unmeasurable. So I really want us to think about that. It's a phenomenal opportunity. Today is also a day to contemplate a bit, to contemplate the meaning of what it is to be a physician. A degree is just the first part. The rest comes from our professional obligation and our dedication. We need to appreciate the limits of science and the power to care and relieve suffering. Perhaps most importantly, though, today is a day to dedicate. At the end of the ceremony today, each of our new doctors will take a voluntary oath to commit their lives to serving patients with compassion and as fellow human beings. It will be the degree that they will, the degree to which they fulfill this obligation and this commitment that will establish their professional success. In addition, one of our graduates will also take a voluntary oath to support and defend the Constitution of the United States as a commissioned officer in the Army. So today they dedicate their lives to a new professional path, one that goes beyond the ordinary and which can become quite extraordinary. So, first and foremost, however, today is a day to graduate. So why don't we begin with the ceremonies? Thank you all for coming, and we look forward to a great day.
Mr. Ryan LaFollette has been selected by the class of 2012 as their student speaker. Will Mr. LaFollette please come forward?
Morning, faculty, friends and family, and most importantly, the class of 2012. Nice hats. It's a great honor to be speaking in front of you today. Thank you to the class for electing me your president for the last 4 years. Thank you for electing me to speak today. I did, however, find a study by Redomeyer in 2004 showing that the life expectancy of a class president in medical school is 2.4 years shorter than their colleagues. So thank you for your votes. So we've walked a long road deep into debt to get here. And at close to the second decade of schooling, we're finally done with this stage and ready to be right back at the bottom again next year. But I want to take a minute and just go through the last 4 years and how we got here. So do you remember going home the first time after an admin class? Your mother, father, aunt, uncle asked you about their hip, knee, back, ankle pain? So I had a similar situation, and I found that the best thing to do as a first-year medical student who had no knowledge of anatomy or physiology or pain was to say, you're probably not going to die from that. And that usually got by. So after that, in our second year, we buried ourselves deep in books, in the depths of the library, finding new addictions to caffeine and Panera. And we studied a little information about an extraordinary amount of things. And we started repeating mnemonics deep into our REM cycles. And at some point, each of us, at the end of a very long day, at the end of a series of very long tests, on one of those famously sunny Syracuse days like as outside today, we'd start playing the game of what if about potential other careers that we would be doing. Like a quilt maker or an actor. We have an extraordinary class here, and all of the things that you would dream of doing, someone in this class has already done before getting to medical school. But I think it's safe to say that clinical rotations third year were full of ups and downs, from first successful resuscitations of another human life to counting the tiles in the OR and 8 hours of surgery. And how many times do you get to be in the FBI and an alien in the same day, except for on your psychiatry rotation? But for the first time, we saw the point of our labor. We saw the point of why we came into medical school. To wake up at 5 a.m. because you think that there might be something new on the differential diagnosis, and you research it before you get to pre-rounds. And that's why we came to medical school, serve patients. And after an entire year of waking up at 5 a.m., intellectually exhausted, I realized that I still could not spell the word ophthalmology. And that's why I chose emergency medicine. So fourth year came, and we took the road to find ourselves a new home. And we traveled the country. And when we came back, I could articulate better why I loved Upstate. The patients, the faculty, the classmates that all taught us equally here at Upstate. And now, after 4 years of intensive training, I feel very confident that I can return home, and when my family asks me about their pain, I can confidently say, it's probably not going to kill you. And now that we matched, and almost 70 of us are matching in New York State, I want to thank one person who's been there for us since we first walked in the doors of Upstate. He's retiring this year, and every day in our first year since we walked in the doors, he's greeted us in the cold of the lab with a warm smile, teaching us about the brachioradialis and the Pinot that it helps you hold. So please join me on behalf of everyone in our class in a big round of applause for Dr. Barry Berg. And lastly, to the class, it's not necessarily been a smooth ride all of the time, but today, as Dean Duggan said, today is a day to celebrate the accomplishments that you have, thank the family members, friends, and faculty that have helped you along the way. You're an amazing group of people. I'm humbled to walk this stage with you, and congratulations.
It is my pleasure to introduce Dr. Deborah Buchan, President of the Medical Alumni Association.
Thanks, Ryan. That was great. Where are you? Okay. On behalf of the Upstate Medical Alumni Association, I'd like to thank you for inviting me to share this wonderful day with you. As a prior graduate and a member of the faculty here, I'm well aware of how hard you've worked in the last 4 years to get here. I have utmost confidence that Upstate Medical University has prepared you for success in residency and beyond. It is my honor to welcome you as permanent members of our Alumni Association today. You will join nearly 10,000 members throughout the U.S. and the world. I hope that you will participate in alumni events and support us. Come to regional events where you'll see Dr. Berg, and to alumni weekends. Again, on behalf of the Medical Alumni Association, congratulations and best wishes to you.
Dr. Deborah Buchan will present the Medical Alumni Awards. She will be assisted by Dean Duggan, Dr. Rajesh Dave, Dean of the Binghamton campus, and Dr. Lynn Cleary, Vice President for Academic Affairs and College of Medicine, Senior Associate Dean for Education. The class of 2012 recognizes faculty and departments by nominating them to receive awards from the Medical Alumni Association. Would this year's recipients of the Medical Alumni Awards please come forward as I announce your name? Philip B. Armstrong Award, Dr. Susan Stearns, Department of Cell and Developmental Biology. Basic Science Department Teaching Award, Cell and Developmental Biology. This award will be accepted by Dr. Joseph Sanger. Syracuse Campus Clinical Faculty Teaching Award, Dr. Kwame Amankwa. Syracuse Campus Clinical Department Teaching Award, Department of Pediatrics. This award will be accepted by Dr. Thomas Welsh. Binghamton Campus Clinical Faculty Teaching Award, Dr. Leslie Major. In addition to this award, Dr. Major will also be accepting the Binghamton Campus Clinical Department Teaching Award for the Department of Psychiatry. The Leonard Tao Humanism in Medicine Faculty Award, presented by the Arnold P. Gold Foundation, recognizes and honors a faculty member who demonstrates the highest standard of integrity, excellence, compassion, altruism, respect, empathy, and service. Dr. Brian Johnson has been selected by the graduating class to receive this award. It gives me great pleasure and honor to present Dr. David Smith, President of the State University of New York, Upstate Medical University.
Good morning. This is indeed a good day to celebrate, and certainly one that all of us know is a noteworthy one as we look forward to the careers of these incredible individuals. But a couple of things that I'd like to do first, and important. I think not only are there many dignitaries on the stage, but one of the greatest honors that all of us have is to be part of a great faculty. At this time, I would like to ask the faculty of Upstate Medical University College of Medicine to please stand and be recognized. Thank you. To our friends, families, and other distinguished guests, and to all of our graduates, welcome to this very special commencement. As a president, I'm very proud of the accomplishments of this class, to the graduates, and of course, in just a few moments, to these physicians. Let us take a moment now, though, to recognize those loved ones whose hard work and commitment have helped each and every one of you who who are graduating here today, to those people who listened when you needed to talk, who provided encouragement and support, tangible and otherwise, who may have gone without so that you could succeed. Will the parents of the graduates please stand and remain standing? Thank you. We now know why this class is so successful. Will the husbands, wives, and partners of the graduates also please stand? Thank you. And I saw some of them already, but will the children of the graduates please stand as a pediatrician? We don't leave anyone out. Will the grandparents, great-grandparents please stand? And any other relatives or friends, please stand. With all sincerity, our graduates thank you, this college thanks you, as does this great university, for all of your support, your kind words and thoughts, and indeed all of the times that we were there for each and every one of those, and into the future. Your role has been a vital one. On behalf of the faculty and staff of Upstate Medical University, again, I want to congratulate each and every one of you. We share in your pride and your achievement and are confident you will bring expertise, caring, and accomplishment in your chosen field. I have just a few quick remarks. First is a prescription from a rather famous doctor who said, "Be who you are and say what you feel, because those who mind don't matter, and those that matter don't mind." Dr. Zeus. Be also a student of history. In an era of multi-drug resistant microbes, emerging, re-emerging infections, epidemics and obesity and the metabolic syndrome, it was Ivan Illich who decades ago reminded us with great humility that man himself has created new disease. And one thing, as I said to you 4 years ago, that we all have in common, we either will be or we have been, and that is a patient, each and every one of us. We will not avoid that moment. While we all stood just a few minutes ago for a variety of reasons and recognitions, we will ultimately be a patient. And we will place our lives, our passion, our emotions, and our fears in the hands of this graduating class and their colleagues. And I can tell you, as the president of this university, we will be in the very best of hands because of their ability to not only diagnose, but also to care with compassion, because indeed their legacy has been a grand one here at Upstate Medical University. And finally, I would ask the graduates to remember our mission. It is a noble one, often said to be teaching, research, and service. But this university saves lives. And the graduates of this university will save the lives of our grandchildren and great-grandchildren. And through research, we create hope. And indeed, that is the legacy they will establish and leave for each and every one of us. And we are indeed celebrating an incredible group of individuals who I know could certainly care for any of my family members with the utmost of capabilities and compassion. Congratulations to the graduates. Today, the State University of New York, Upstate Medical University, will award an honorary degree to Dr. Patricia Joy Newman. Mr. David Northrup, Jr., Chair of the Upstate Medical University Council, will read the citation. Dr. McGee, Chief Marshal, will assist me with the hoodie.
I will now read the citation. Dr. Newman, your achievements distinguish you as a renowned surgeon and a pioneer in medicine. You have contributed to many areas, your chosen field of surgery, the advancement for women in medicine, and the surgical educational standards for students, residents, and surgeons. Since your graduation in 1965 from Upstate, you have made significant contributions that have benefited SUNY Upstate, our region, and the nation. This includes your role as founder of the Association for Women Surgeons, which is now 3,000 members strong. Just as you are a leading force in your profession, so are you highly respected for your volunteer service on national committees, your advocacy for patients, and your contributions to advancing education. You have the respect of your medical peers. This is evidenced by your elections to the highest offices of the organizations in your field, including the presidency of the American College of Surgeons, and your listing in the book, Best Doctors in America. Your patients revered you. You established a standard of service that has been nationally acknowledged. Locally, you founded and ran the Comprehensive Breast Care Clinic, bringing compassionate care to thousands of patients. By your exceptional skills, focused efforts, engaging personality, and faith in the human need for justice, you have been recognized as a conscience of the profession. For your leadership in all these fields, it is my distinct honor to present you, Dr. Patricia Joy Newman, as the candidate for the degree of Doctor of Science, honoris causa.
Dr. Newman, by virtue of the authority vested in me by the trustees of the State University of New York, the faculty of the State University of New York concurring, I confer upon you the degree Doctor of Science, honoris causa, and invest with you all rights and privileges pertaining thereto. In token thereof, I have for you this diploma and the hood appropriate to your degree. We will now hear some remarks from the new double doctorate.
President Smith, Mr. Northrup, Mr. Murad, Dr. McGee, graduates, faculty, friends, and family, thank you for this tremendous honor. One can receive no greater honor than to be selected by your peers in your own institution for an honorary degree. After all, they really know you, warts and all, as the expression goes. So this is just an overwhelming honor. I wish I'd had the foresight to ask the to-be Dr. LaTourette to rate my comments, but unfortunately for you, I didn't, so you'll have to bear with me. When I arrived at Upstate 51 years ago from Denver, New York, a small rural town in the Catskill Mountains, I could have never imagined the opportunities I would be given and the great joy I would experience as a doctor. Despite having many opportunities to leave, I have always chosen to stay. Syracuse is a great place to live, and Upstate is a great medical school. I have had wonderful colleagues. Upstate has also afforded me the opportunity to watch year after year as our faculty, students, and graduates make enormous contributions to society. They have led great universities and organizations, done amazing research, and provided care for innumerable patients. Each year at commencement, I see another group of students become physicians and embark on this amazing journey. And in the words of Dr. Seuss, oh, the places you'll go. If you have not read that book recently, I would really advise you to do so. In simple words, there is a profound message that there are no limits to what you can accomplish. My message to today's graduates is you too can do amazing things. Just go for it. Your only limitation will be yourself. Each of you came to medical school with a desire to become a physician, a desire to care for people, and a desire to do good. Be optimistic and you will have opportunities everywhere. Caring for people frequently during the most difficult periods of their lives is an inordinate privilege, but it can also be draining. Make sure to always empathize with your patients, always treat them with respect, always allow them to preserve their dignity, and you will be immensely satisfied. The day-to-day work of medicine is sometimes very challenging and heartbreaking. It is easy to lose sight of your ideals or become discouraged. I encourage you to have good friends outside of medicine. They help you keep perspective. Spend time with your family. They will always center you and remind you of your basic worth. Do work that you enjoy. There can be no greater pleasure than going to work each day knowing that you will make a difference. And if you find that things are not going well, have the courage to reassess what you are doing and change it. I encourage you to participate in organizations both within medicine and your community. They open opportunities for you that you are not available if you don't participate. For me, they allowed me the privilege of knowing people throughout the world and impacting the well-being of people in ways that I would not have imagined. Don't wait to be asked. Volunteer. If you see a need, work to fix it. You can always find like-minded people who are willing to help you. You have heard in the citation read about my career the many things I have done. So can you. You need to be involved to have these opportunities. Take full advantage of the incredible privilege that accompanies your being a physician. Never forget the basic altruistic, humanitarian desire that brought you to medicine. Don't ever believe that you cannot create change. I was from a small town. I did not have a privileged education, nor was I wealthy, but I have accomplished a lot. So can you. Have faith in yourself. Have the moral courage to do what needs to be done and what is right, and you too can make a huge difference and have an incredible life. Congratulations on your great achievement. I hope you have as much pleasure in your career as I have had in mine. Thank you.
Today, the State University of New York, Upstate Medical University, is granting an honorary degree to Dr. Abraham C. Verghese. Mr. Northrup, Jr., Chair of the Upstate Medical University Council, will read the citation. Dr. McGee, Chief Marshal, will assist me with the hooding.
I will now read the citation. Dr. Verghese, your accomplishments as a distinguished physician and prolific author have influenced the lives of many and make you one of the most inspiring clinicians of your generation. Your deep commitment to bedside skills and physical diagnosis has forged your reputation as being a consummate advocate for patients. You understand that medicine is about people. As you were instrumental in the development of the Stanford 25, an initiative designed to showcase and teach fundamental exam skills to interns, you have advanced the practice of medicine while paving the way for the next generation of caring physicians. In your New York Times best-selling books, My Own Country, The Tennis Partner, and Cutting for Stone, you have offered insights into the fundamentals of bedside medicine that are essential to patient care and to the doctor-patient relationship. For your skill, talent, and insight, illuminating the lives of others through medicine and your own experience, it is my distinct honor to present you, Dr. Abraham C. Verghese, as the candidate for the degree Doctor of Humane Letters, honoris causa.
Thank you, Mr. Northrup. By virtue of the authority vested in me by the State University of New York Board of Trustees and the College of the State University of New York, I hereby grant the honorary degree Doctor of Science, honoris causa, to Dr. Abraham C. Verghese, with all rights and privileges therein. Here is the appropriate diploma for that recognition. and we congratulate you for your contributions and your ongoing insight and passion for the practice of medicine. We will now enjoy some remarks from Dr. Verghese.
President Smith and distinguished faculty and guests, and especially the graduating class, it's a great privilege for me to receive this honorary degree. I am both a physician and a storyteller, and I want to share one quick story, if I may, with the graduating students. Many years ago, I found myself in Johnson City, Tennessee, a small rural town, taking care of many more patients with HIV than anyone had expected. And this was the days before we had any of the therapy that we take for granted. And so a lot of our care revolved around simply being with the patients, visit after visit, and watching them decline. And I remember one morning waiting to see a patient who I hadn't seen for a while, and I'd formed a bond with him. I looked forward to his visit. And the family called to say he wasn't coming to the clinic because he was too weak to come to the clinic. And yet he wasn't sick enough to be in the hospital. And I suddenly realized that I might not see him again unless I did something different. And so I elected to leave the threshold of the medical industrial complex that we all work in, and I went to the patient's home to see him, about a 1-hour drive from where I was. And when I got there, even though I had gone there for my own purposes, because I felt the need to see him, I found that my visit had a profound effect on the family and on the patient, helping them to come to terms with this illness. And when I left, I remember driving away thinking, wow, this is what the horse and buggy doctor of 100 years ago did so effectively in this country. The difference between healing and curing. I was able to heal, in a sense, even though I could not cure. And the analogy that I like to share with you is, if you were to imagine going back to your apartments or your homes, God forbid today after such a lovely day, you walk to your apartment or home and find that the lock is in splinters. The door is open. You walk through the house and everything is in disarray and all your valuables are missing. Your computer, your money, your jewelry, your cash, your iPad, God forbid, has been taken as well. You will be devastated. Not only have you suffered a physical loss of stuff, but you've also suffered a sort of spiritual violation. Someone has come into your sacred space and done something to you. And if the police come by an hour later and say, we found the person who did this, here is all your stuff back, you will be cured, but you will not be healed. Your sense of violation will be so strong that you might choose to leave the place that you're dwelling in and find a new residence. I'd like to leave you with the notion that all illness has these two attributes. There is a physical sense of loss, which we in Western medicine are very good at dealing with, but there's always a sense of spiritual violation. And with diseases like cancer, HIV, that sense of spiritual violation is huge. So I'd like you to humor me for just a second, if you wouldn't mind. Take a look at your right hands, if you would, graduates of this wonderful university. Take a look at that hand. I don't know how long it's been since you actually studied your hand and thought of it as an instrument. But I want you to recognize that that hand, in the case of many of you, will go on to do very specialized technical things. Others of you, it will control remote instruments that also do very specialized technical things. For others of you, it will be a writing tool, and your main work will be cognitive. But I want you to recognize that every one of you has a hand that has the potential to be laid on another human being and to provide healing even when you cannot cure. I wish you Godspeed on the journey, and thank you so much for allowing me to be a part of that special moment with you. Thank you very much.
The degree Master of Public Health from the College of Medicine will now be conferred by President Smith. Dr. Donna Bakke, Director of the Central New York Master of Public Health Program, will present recipients from the MPH program.
President Smith, as Director of the Central New York Master of Public Health Program, I have the honor to present these recipients for the degree of Master of Public Health. They have satisfied the requirements established by the faculty and have been recommended by the faculty for the receipt of this degree.
Thank you, Dr. Bakke. Will all the candidates for the Master of Public Health degree in the College of Medicine please rise?
They went back there. So, Tom.
By virtue of the authority vested in me by the trustees of the State University of New York, upon completion of all requirements, I confer upon each of you the degree Master of Public Health with all rights, privileges, and obligations therein. Please come forward to be recognized. Congratulations.
Lauren R. Hartung. Heather Marion Shannon. Amit Munshi Sharma. Kathy Henry Sennett. Jeanette M. Zeckler.
President Smith, Dr. Duggan and I have the honor to present the first graduate who participated in Upstate's MD-MPH program, which over a 5-year period allows students to complete the requirements of both the Doctor of Medicine degree and the Master of Public Health. This student has satisfied the requirements established by the faculty and has been recommended by the faculty for receipt of these degrees.
Okay. Will the candidate receiving both degrees, Doctor of Medicine and Master of Public Health, please rise and come forward? By virtue of the authority vested in me by the trustees of the State University of New York, upon completion of all requirements, I confer upon you the degrees Doctor of Medicine and Master of Public Health with all rights, privileges, and obligations therein. Please come forward to be recognized.
Dr. Julie Hyung Lu. Dr. David Duggan, Interim Dean of the College of Medicine, will now present the recipients of the degree Doctor of Medicine.
Dr. Smith, as Interim Dean of the College of Medicine, I have the honor to present these recipients of the degree Doctor of Medicine. They have satisfied the requirements established by the faculty and have been recommended by the faculty for the receipt of this degree.
Thank you, Dr. Duggan. Will all candidates for the Doctor of Medicine degree in the College of Medicine please rise? By virtue of the authority vested in me by the trustees of the State University of New York, upon completion of all requirements, I confer upon you the degree Doctor of Medicine, with all of its rights, privileges, and obligations. Please come forward to be recognized. Congratulations.
Dr. Lilia Abruken. Dr. Andrew Paul Egoliati. Dr. Linda Manya Ama. Dr. Dana Amarayan. Dr. Ekena N. Anaka. Dr. Alexandria Christina Andrikopoulos. Dr. Kenneth Lee Angelino. Dr. Erica Lynn Archer, winner of the AMWA Glasgow Rubin Citation for Academic Achievement. Dr. Carrie Eileen Aronson, winner of the AMWA Glasgow Rubin Citation for Academic Achievement, the Binghamton Campus Department of Psychiatry Award, and Binghamton Campus Department of Pediatrics Award. Dr. Michael Osley. Dr. Chinelo Oyenye Atoego. Dr. Nicholas Barranco. Dr. Barranco is winner of the Department of Obstetrics and Gynecology, Mr. and Mrs. William J. Gordon Medical Student Award. Dr. Stephanie Lynn Barrett. Dr. Allison Emily Bars. Dr. Colleen Brianna Bertoni. Dr. Joshua David Bevins. Dr. Wasan Balacho. Dr. Megan Nicole Bolrus. Dr. Lewis William Britton IV. Dr. Sean M.C. Brown. Dr. Christopher O. Brown. Dr. Jessica Campbell. Dr. Campbell is the recipient of the Robert E. L. Nesbitt, MD Student Award, the AMWA Glasgow Rubin Citation for Academic Achievement, and the Student Research Day Awards for 2012. Dr. Elise Catherine Capuccio. Dr. Jennifer Madeline Caputo Seidler. Dr. Caputo Seidler is recipient of the AMWA Glasgow Rubin Citation for Academic Achievement. Dr. Sarah Cardillo. Dr. Cardillo is recipient of the Binghamton Campus Department of Neurosurgery Award, Binghamton Campus Department of Obstetrics and Gynecology Award, and the Binghamton Campus Department of Internal Medicine Award. Dr. Maria Chang. Dr. Marvinia Charles. Dr. Anjali Robin Cherakuri. Dr. Minyurazi Chimu Kangara. Dr. Kristen Marie Critelli. Dr. Ryan Dennis Cuff. Dr. Cuff is recipient of the Robert E. L. Nesbitt Jr. MD Student Award. Dr. Christina Di Battista Cuff. Dr. Cuff is recipient of the Howard Weinberger MD Award in Pediatrics, the AMWA Glasgow Rubin Citation for Academic Medicine Achievement, and Excellence in Anatomical Sciences Award. Dr. Farah Dakay. Dr. Dekay is the recipient of the Medical Society of the State of New York Community Service Award. Dr. Vladimir Davidyuk. Dr. Jean Anthony DeCastro. Dr. Amit Bipin Desai. Dr. Pamela Connor Egan. Dr. Mohammed Salman Faruqi. Dr. Hannah Lynn Fassel. Dr. Jessica Lee Ferger. Dr. Wing K. Fock. Dr. Marcia Alwina Friedman. Dr. Carol Allison Fries. Dr. Fries is recipient of the Herbert Lurie MD Award. Dr. Hillary Megan Gamble. Dr. Amanda Dale Gerard. Dr. Mikhail Gertzberg. Dr. Daniel Day Goldstein. Dr. Goldstein is recipient of the Leonard Toe Humanism in Medicine Award. Dr. Kara Marie Grome. Dr. Christopher Lewis McPherson Harmon. Dr. John Stephen Harrington. Dr. Harrington is recipient of the William J. Williams, MD, Award in Internal Medicine. Dr. Nathaniel David Herr. Dr. Brian Michael Hogue. Dr. Timothy Tenren Fung. Dr. Hui N.D. Huang. Dr. Eileen Wong. Dr. Mark Hayden Hodges. Dr. Hodges is the recipient of the Merck Manual Award. Dr. Samuel Marcus Heiken. Dr. Bilal Zafar Iqbal. Dr. Carolyn Sue Kay. Dr. Stefan George Kazakos. Dr. Dylan Sean Kellogg. Dr. Kellogg is recipient of the Excellence in Emergency Medicine Award. Dr. Gary Kim. Dr. Juliana Okromia Kisedu. Dr. Anna Jill Klausner. Dr. Klausner is the recipient of the AMWA Glasgow Rubin Citation for Academic Achievement. Dr. Gabriel Klein. Dr. Klein is the recipient of the A. Gino Andreatta Student Affairs Award. Dr. Robert Walter Kopp. Dr. Ryan LaFollette. Dr. LaFollette is a recipient of the A. Gino Andreatta Student Affairs Award. Dr. Rebecca LaValle. Dr. LaValle is the recipient of the Ernest Carhart MD, Paul Palmer MD Award. Dr. Latoya Latrice Lawrence. Dr. Brendan Hosey Leahy. Dr. David C. Leibowitz. Dr. Leibowitz is the recipient of the American College of Emergency Physicians Medical Student Professionalism and Service Award. Dr. Adam Tedero Legnier. Dr. Elisa Gail Leidecker. Dr. Justin Adam McKinnon. Dr. Joseph Alexander Mailman. Dr. Jennifer Carol Macon. Dr. Robert Charles Mason. Dr. Mason is the recipient of the David G. Murray, MD, Orthopedic Surgery Award. Dr. Tony Matthews. Dr. Matthew Daniel McGraw. Dr. Tigist G. Mahari. Dr. Tony Marie Melville. Dr. Michael Andrew Mercurio. Dr. Jacqueline Menasso. Dr. Menasso is the recipient of the James L. Potts, MD, Medical Principles Award. Dr. Shanti Renee Mitchell. Dr. Kate Allison Myers. Dr. Joshua Jude Nelson. Dr. Nelson is the recipient of the Mark H. Hollander, MD, Psychiatry Award. Dr. Sophie Noel. Dr. Basilia Oyenye Wankwoa. Dr. Wankwo is the recipient of the Stuart I. Grumman, MD Award. Dr. Richard Obiji. Dr. Obiji is the recipient of the James L. Potts, MD, Medical Principles Award. Dr. Peter Thomas Osgood. Dr. Chirag Dinesh Patel. Dr. Angela Marie Percosi. Dr. David Jonathan Pinter. Dr. Alexander Pell Preuss. Dr. Blesserine Jacinto Ponzalan. Dr. Neetha Reddy. Dr. Rohith Rapala. Dr. Rapala is recipient of the David Turner Award. Dr. Samuel Michael Richter. Dr. Yumna Saeed. Dr. Brian David Santa Cruz. Dr. Evan Andrew Savage. Dr. Cassandra Lynn Scales. Dr. Scales is recipient of the State University of New York Chancellor's Award for Student Excellence and the Endocrine Society Medical Student Achievement Award. Dr. Nicholas Joseph Schott. Dr. Jessica Kelly Sempler. Dr. Kakashasha M. Shaw. Dr. Christina Rose Shavitz. Dr. Alex Gordon Schindel. Dr. Genevieve Hermant Shirali. Dr. Shirali is recipient of the AMWA Glasgow Rubin Citation for Academic Achievement, the David Turner Award, the Medical Alumni Association Academic Achievement Award, and the Merck Manual Award. Dr. Benjamin Alexander Silverman. Dr. Harinder Pal Singh. Dr. Sujata Nidhi Singh. Dr. Erica St. James. Dr. Connor McColgan Stack. Dr. Rachel Elizabeth Stahl. Dr. Rebecca Stalter. Dr. Stalter is the recipient of the AMWA Leadership and Service Award. Dr. David Seth Strasberg. Dr. Strasberg is the recipient of the Merck Manual Award. Dr. Megan McCarthy Stumpf. Dr. Aaron James Stupple. Dr. Aurel Yehuda Swenson. Dr. Lindsay Brianne Tamborell. Dr. Tamborell is the recipient of the AMWA Glasgow Rubin Citation for Academic Achievement and the Binghamton Campus Ronald Krasnowski Award. Dr. Jill Nicole Tirabassi. Dr. Tirabassi is the recipient of the Kelsey Foundation Award. Dr. Nicole Christine Toscano. Dr. Toscano is the recipient of the American Academy of Neurology Medical Student Prize for Excellence in Neurology. Dr. Zin Min Tun. Dr. Zaya Natasha Venatelli. Dr. Alan Justin Viglione. Dr. Christopher David Weaver. Dr. Weaver is the recipient of the Binghamton Campus Department of Family Medicine Award and the Binghamton Campus Department of Surgery Award. Dr. Carrie Elizabeth Whiting. Dr. Whiting is a recipient of the Pathology Award. Dr. Danielle Williams. Dr. Zachary J. Williamson. Dr. Carrie Allison Wilson. Dr. Rachel Beth Zaire. Dr. Yachao Zhang. Dr. Zhang is a recipient of the Award for Outstanding Medical Student in Urology. Dr. Xinmin Zhao. Dr. Susan Lynn Zolkowski.
The physician's oath in the tradition of Hippocrates and Elizabeth Blackwell, which is printed in your program, will be administered to the medical graduates by Dr. Kwame Amankwa. Dr. Amankwa has been selected for this honor by the graduating class. Will the medical graduates of the College of Medicine please rise?
Will all the medical graduates in the College of Medicine please repeat after me? I enthusiastically commit my life to serving patients. I will practice my profession with integrity, dignity, and humility. The welfare of my patients will be my first consideration, and I will advocate for them. May I never see in the patient anything but a fellow human in need. I will treat all my patients with compassion, no matter how much they differ from me. I will preserve my patients' confidentiality and respect my patients' choices. I will work together with my colleagues in service of our patients. I will acknowledge my limits, maintain my skills, and seek help when needed. I will give to my teachers the respect and gratitude that is their due, be a role model for students, and share my knowledge with patients and colleagues. I make these promises solemnly, freely, and upon my honor. May I keep this oath and, in so doing, experience the joy of healing those who seek my help.
Please be seated. The recipient of the two doctoral degrees, Doctor of Medicine and Doctor of Philosophy, will be presented by Dr. Stephen Youngentov, Associate Dean of the College of Graduate Studies and Co-Director of the MD-PhD program, assisted by Dr. David Duggan, Interim Dean of the College of Medicine.
President Smith, Dr. Duggan and I have the honor to present these graduates who participated in Upstate's MD-PhD program, which over an approximately 7 to 8 year period of time allows students to complete the requirements of both the College of Medicine's Doctor of Medicine degree and the College of Graduate Studies Doctor of Philosophy degree. These students graduate as physician scientists who, by combining the practice of medicine in the clinic with biomedical research in the laboratory, are uniquely trained and focused to bring the power of modern science to our understanding and treatment of human disease.
Thank you, Dr. Youngentab and Dean Duggan. Will the candidates receiving both doctoral degrees, Doctor of Medicine and Doctor of Philosophy, please rise? By virtue of the authority vested in me by the trustees of the State University of New York, upon completion of all requirements, I confer upon each of you the degrees Doctor of Medicine and Doctor of Philosophy with all rights, privileges, and obligations herein. Please come forward and be recognized.
Dr. Adam Matthew Gerber. Dr. Stephen Daniel Hicks. Dr. David J. Lubin. Dr. Young Liu. Dr. Akos Mersic. Dr. Anna Janine Nichols.
We will now begin the commissioning ceremony for the Health Professions Scholarship Program students. Representing the U.S. Army is Major Andrew Parisi. Dr. Julie R. White, Dean of Student Affairs, will assist with the certificate. Will the student who is being commissioned please come forward and face the audience?
Good morning, graduates, families, faculty, and dignitaries. It is great pleasure that I open this commissioning ceremony honoring the graduates of the Health Professions Scholarship Program. The Health Professions Scholarship Program offers prospective military physicians a paid medical education in exchange for service as a commissioned medical officer. Created under authority for the Uniformed Services Health Professions Revitalization Act of 1972, the Health Professions Scholarship Program is a primary source of trained healthcare professionals entering the United States Armed Forces. Upon graduation, the students are promoted to the rank of captain in the Army and Air Force or lieutenant in the Navy. And medical school graduates are placed on active duty for residency training. Upon completion of their residency, they will then proceed to their first duty assignment where they will be integrated into the military's medical community. Today, Dr. Steven Casicos has chosen a noble thing, that thing being a physician. He has also chosen another noble field. He has chosen to serve his country. He has dedicated himself to taking care of those who protect our freedoms. It is the men and women of our armed service, the defenders of freedom, that count on doctors like you, knowing that you will be there when they need you most. And for this, we are grateful. You have distinguished yourself today by not only earning your diploma, but also your commission as a captain in the United States Army. The military officer's oath is a combination of constitutional requirement, historical influence, and centuries-old customs. Military oaths date back to ancient Rome, where soldiers pledged loyalty to a specific general for a specific campaign. After the campaign ended, the oath no longer applied. In the United States, oaths are part of life from the early colonial days. The first oath of office for United States military officers under the Constitution was established on 1 June 1789. Today, over 200 years later, that same oath exists. With Memorial Day right around the corner, it wouldn't be appropriate if I didn't recognize the faithful service and outstanding bravery of all American soldiers that have given the ultimate sacrifice for our freedoms. Every single man and woman serving in our Army today volunteered to serve. These soldiers and their families are truly decoration of America's military. They grew up in the shadows of September 11th, 2001, a defining moment for most of them, and many have endured multiple deployments with honor, distinction, and pride. Many return home to the streets decorated with yellow ribbons and American flags. Their lives are decorated with hugs, kisses, and handshakes. For others, they return home in a casket draped with the most honored decoration of all, the American flag. They gave everything to support and defend the nation they built life, liberty, and hope. So, what do we owe these rays of ravishing light and glory burning in their hearts? We owe our service, we owe our optimism, we owe our lives. So, I congratulate you, Stefan, for the commission you've earned and for the credit you bring to the United States Army. I wish you all the best of luck in your future, to our soldiers and their families. God bless you and your family, God bless our Army, and God bless America. Thank you. I will now administer the oath of office for the United States Army. Stephen, raise your hand and repeat after me. I state your full name.
I, Stefan George Kazakos,
Having been appointed an officer in the Army of the United States,
having been appointed an officer in the United States Army,
as indicated in the above rank of captain,
as indicated in the above rank of captain,
do solemnly swear
do solemnly swear
that I will support and defend
that I will support and defend
the Constitution of the United States
the Constitution of the United States
against all enemies,
against all enemies,
foreign and domestic,
foreign and domestic,
that I bear true faith
that I bear true faith
and allegiance to the same,
and allegiance to the same,
that I take this obligation freely
I take this obligation freely
without any mental reservation
without any mental reservation
or purpose of evasion,
or purpose of evasion,
and that I will well
and that I will well
and faithfully discharge
and faithfully discharge
the duties
the duties
of the office upon which I am about to enter.
of the office that I'm about to enter.
So help me God.
So help me God.
Congratulations.
Thank you, Major. As we close this commissioning ceremony, I would like to recognize at this time any veterans, both on the stage or in the audience, that have served this country as members of our services. Would all veterans please rise and be recognized?
This concludes our ceremony. Please join me in congratulating all our graduates. Let me remind you, there is a reception immediately following this ceremony at the Campus Activities Building. The recipients of awards may pick up their award at the appropriate awards table at the reception. A photographer is available to take photos of graduates with family and faculty. Also, as a reminder, the graduates will recess to the outside of the building. You will need to meet your graduate outside. Please remain seated until the faculty and graduates have exited. Thank you.